Tuesday, everyone. Cinco de Mayo. Hope you guys are staying safe out there. I'm Randy Murphy, epidemiologist and Director of Disease Surveillance at the Mobile County Health Department, here to give you our summary of COVID-19 as it affects Mobile County. So just to start with our case count worldwide, 3.6 million confirmed cases with over 250,000 confirmed COVID deaths. In the United States, almost 1.2 million COVID cases with nearly 70,000. We're at 68,922 deaths in the United States. In Mobile this morning, the Alabama Department of Public Health data dashboard was reporting 8,120 cases of confirmed COVID-19 in Alabama residents, with 310 of them succumbing to the disease. And in Mobile County this morning, we're reporting 1,230 cases of COVID disease, with 68 who have died from illness. So as you know, we are continuing to expand the information that we're providing to everyone. Yesterday I read some stats that I committed to putting in today's report, and we did that. Had a couple of folks comment that we seem to be missing some math. So yes, in the new table 2 with detail on those that have been hospitalized and died, we had not included the number of missing in several of categories. So those of you who are sticklers for things adding up, please accept our apologies, and we have that information corrected now. So again, among 1,230 cases of COVID-19 disease in Mobile County residents, we're reporting on 161 that have been hospitalized during the course of their illness, and 68 who have died from illness. We began reporting on the number of healthcare workers in that count. So 177 of our cases were known to be healthcare workers. That's around 14.5%. 91 were known to be employees at a long-term care facility, or 7.4%, and 184, or 15%, residents of a long-term care facility, again, reflecting that we have outbreaks going on in several long-term care facilities. For those people who were sick and are now no longer reporting symptoms, that represents about 26.5% of our cases, or 242 of the 1,230. So a little bit more information on those that have been hospitalized and who have died, So among those that are hospitalized, 60% of the patients who've been hospitalized with COVID disease were 65 and older, and 26% between 50 and 64 years old. Most of them are female. This is reflective of our cases. 52% are female, 58% are African American, and about 44% of those were in intensive care for some part of their stay in the hospital, and 24 of those required mechanical ventilation at some point during their hospital stay. We know that being admitted to intensive care and being on a mechanical ventilator are risk factors for severe outcomes. They don't necessarily cause the disease to get worse. It's just reflective of the acute respiratory distress syndrome that COVID-19 causes in people who are 65 and older or have underlying medical conditions. Among the 68 that have died, 75% of those were in the 65 and over category, and 24% in the 50 to 24. I think we talked yesterday about the 135-year-old that has died with COVID, who had underlying conditions and disabilities. Among the 68 who died, we see a slight flip in the sex category, and that 57% of them are male. This is fairly indicative on a larger scale of what some geriatric and sex and gender equality researchers have known for quite some time, that sometimes men delay seeking treatment until sometimes they are in crisis. So again, just sharing this information with you so that if you have family members who are in these categories, you can encourage them to pay closer attention to their health and complications of illness, to try to seek medical attention as soon as possible when you experience complications. Among the 68 that have died, 53% of those were African American, 40% white, and most of them were hospitalized at the time of their death. We know that several long-term care facility residents have died in residence, and we're continuing to tease out the information to make sure that we can continue to say that all of the folks that died had underlying medical conditions that made them more vulnerable to complications of COVID-19 disease. I've just about teased that out for everyone, and hopefully I can include that in the report tomorrow. So we got a little nervous over the weekend when we had a spike in the number of cases reported on Friday as being 69. We know that about half of those came from one laboratory. We don't think that there has been any other biological explanation for that spike, and we're pleased to see that for the past few days we have had back numbers reported back to us in the less than 30. So on Saturday 27, on Sunday 26, and yesterday 26 new cases of COVID-19 reported to us. I've had some requests to try to tease out our map a little bit more so that the downtown area can get some more visibility on the number of cases in that eastern part of the county where we have very small zip code areas, so I'll work a little bit on that. All right, on to the Q&A segment of our show. We have some media reports. First, I want to just read one that was prepared by our Inspection Services Program Manager, Brad Phillips. I think the question was, working on a story, blah, blah, blah. This is about shutting down businesses, or, who has the authority to shut down a business or take away the license of a business that's refusing to comply with the state safer at home order or any local ordinances. And so Brad put together a really thoughtful reply to this. While Mobile County Health Department can move to suspend permits of establishments that are normally under our jurisdictional control, effectively removing the ability for them to operate is for law enforcement to enforce. So that legal closure is a law enforcement responsibility, not a health department responsibility. And we also have no control over the issuance or revocation of a business license. That is generally by the city or county. What we do is permit an establishment to serve a certain kind of food or beverage, or to operate a pool or whirlpool, things of that nature. We don't have the authority or ability to issue or revoke business licenses. And just to remind everyone that if someone intentionally violates the state health order, the Safer at Home, which was issued as an emergency rule, that is punishable as a criminal misdemeanor. All right, so moving on from that. Someone was asking about you may have seen in the news, the sheriff in Baldwin County is saying that they're not going to enforce the governor's order, and the question to us was, given the proximity of Baldwin County to Mobile County and the frequency of people going back and forth, are we concerned that decisions could lead to more positive cases in Mobile County? We know that can happen. Of course, there are the virus doesn't hop off at the border. It will continue to travel back and forth. I think that I'm not any more concerned about Baldwin County people coming here than I would be concerned if I lived in Baldwin County about people coming to my beaches. So I think that, we know that there is carriage of disease across county lines. The last couple of outbreaks that I've been involved with in Mobile County, mostly coronavirus and also we're having a hepatitis A outbreak, it seems as if most of our cases are traveling from the west and coming through Mississippi and to Mobile, more so than cases and transmission coming from the east and coming into Mobile. But that's just an anecdotal observation by an experienced epidemiologist. I don't have any any data to back that up. Qualitative data, not quantitative data. All right, here are some media questions. Some of these are quite complex and I'm not going to be able to answer all of them. Can somebody answer why Mobile County has the largest number in the state? I can't answer that with all certainty. It likely is not a single cause. It likely is multifactorial. We have a lot of outbreaks. We're still testing mostly people who are symptomatic. We have 10 testing sites out there now. We think that people who need to get tested have enough locations out there. Again, some of the testing sites are reporting a lack of interest, at least on the weekend. So there are lots of things that are likely contributing to this, and we'll continue keeping a close eye on it. Lots of questions about how many people are getting tested. I have said from the beginning that those data are so messy that I try not to spend too much time trying to make heads or tails of really messy data. That those numbers are reported daily on the Alabama Department of Public Health data dashboard. So if you're interested in day over day or week over week changes in that number, please pay attention to that website and grab those from there. Because again, I don't stake a lot of weight in that, except to try to get a feeling for about what % of our population is receiving a test. There are some lawmakers and politicians that are trying to use a 2% of the population needs to be tested in May measure as something that they think about among many other things when they're talking about potentially reopening. So stay tuned. You can check on the White House reopening plans for more information about that, or check with the governor's office or the state health officer. Let's see. Someone asked a question about something a state senator said on the floor yesterday. That statement is not anything that really I can comment on. This was about crisis standards of care and the use of ventilators when ventilators are in short supply. But really, we don't have to worry about that right now because ventilators are not in short supply. And we have enough ventilators that we need right now for everyone who needs one can have it for as long as they need it. Someone asking me to comment on an outbreak at a apartment complex, which I cannot. Something about something the mayor said, which that goes back to the mayor. Of the 68 deaths in Mobile, do we know how many of those were residents in long-term health care? That's now in our daily report, and I just mentioned that. Do we have enough test kits for everyone to get it? It seems like we do, like I said, because over the weekend we had locations that were shutting down early because they didn't have anyone queued up to receive a test, so they closed up and went home for the day. Again, the 10 locations that we know of that are testing using the PCR test in Mobile County are on our public website at mchd.org. All right, here's some from Facebook. Are employees that work in nursing homes been tested for COVID? Are they required to continue to work, or are they quarantined at home or work? To the greatest extent possible, when someone is exposed or tests laboratory positive for COVID, we try to keep those people at home until they meet the criteria for lifting isolation. In some very critical situations where staffing is low and we still have to maintain we have to maintain healthcare, we may end up bringing a healthcare worker back into a healthcare setting who previously tested positive but is asymptomatic, as long as they wear their mask and meet all the other CDC recommendations. So that is not a Randy Murphy decision. That is a CDC recommendation to, thanks Mark, that when we are in crisis contingency mode, which means we are low on PPE, low on testing, low on staff, high on the number of patients that are in isolation, that there are some preferences as to how you use staff that have previously tested positive for COVID. So Mark was saying that I mentioned about the 10 testing sites where the PCR testing is available. We get lots of questions about where can I get antibody testing, and you'll have to call those sites and ask them because I don't know. We have not been supporting widespread testing using the antibody test because too little is known about false positives or false negatives, about what it might mean, and everyone nationally, Centers for Disease Control is working with FDA, who's working with NIH, who's working with all the other scientific partners out there to try to figure out if there is a legitimate, valid use of the antibody test. But right now, there are only a few that are FDA approved, and they have to be performed in high complexity laboratories. So, a pop-up clinic is not a high complexity laboratory. So if you are still curious about antibody test locations, sorry, but you'll have to contact those locations to ask. All right. Someone asking a question about organ donation if you die with COVID. And that's a good question, and I think I know the answer to it, but rather than comment on it today, I will do a little reading up on that, since I did several weeks ago, and try to answer that tomorrow, or Thursday. Yeah, Thursday. Let's see. Total cases from congregate settings. So I mentioned that today. The ones that we know are residents or workers of long-term care facilities. That's sort of the same thing as a congregate setting. There are other congregate settings like detention centers and group homes, and things like that. But for the most part, look at the report where it talks about the number of long-term care facility residents. Let's see. So someone making a recommendation that we test all nursing homes before they have a big outbreak. So I just want to comment briefly on this because, again, the PCR can give a false negative if it is used too soon. And generally, you are PCR positive within 2 to 5 days of getting infected. So if I'm exposed and if I get the virus inside my body, there's a 2 to 14 day window before I might start exhibiting symptoms. So let's say I touch my mouth and I introduce the virus into my body. The virus will start to multiply. It takes a couple days for the virus to get to a high enough level to make me sick and to be detected by PCR. That's why we don't just do widespread testing with the PCR test, because it can be a false negative. What we have done is to say, because we know we have asymptomatic infection, so we know that there are people testing PCR positive that are asymptomatic or pre-symptomatic, and because of this, we have started advising, and this is not just a Randy Murphy, this is a state of Alabama and a CDC recommendation, that depending on the local conditions, if a nursing home has a COVID positive staff or employee, we are recommending testing of most of the employees regardless of whether or not they're symptomatic, so that we can get any asymptomatic employees out of that facility as quickly as possible. So again, we have very few tools in our toolbox with which to manage outbreaks and the crisis, and the PCR test right now is the best thing we have for detection. But the best thing we have for prevention is social isolation, social distancing, isolation if you're sick, hand hygiene, cough etiquette, physical distancing, covering your face if you go out. That is the only prevention tool that we have in our toolbox right now, because we don't have a vaccine and we don't have medicine to treat. The testing is important because we want to get people who are spreading virus out of the public as quickly as possible, so that they're not exposing people who are in our community who are vulnerable to severe complications and deaths. When we see report regarding zip codes, please share that info. So we are sharing info on zip codes. I'm not quite sure what that question's about. So if you're watching again today, please give us a little bit more information about your inquiry. Sometimes people don't ask a question on Facebook, they just make a rather lengthy statement. And someone was talking about being sick last fall, and their flu was negative and their pneumococcal pneumonia was negative, but they had influenza-like illness. Could they have had COVID? Probably not last fall, unless you had traveled to Wuhan, China. But there are other viruses out there besides flu that circulate and cause influenza-like illness, like enterovirus, parainfluenza, RSV, I forget what that one stands for, several other. There are about 10 or 12 viruses on the viral respiratory disease panel. And a flu test, depending on what test was used or not, the bedside flu test is not a very reliable test. So sorry, I know you would probably really like to get an explanation for what made you sick, but that may not be possible at this point. Are masks still required? So face coverings are not required for the general population. They are strongly recommended. Strongly recommended. Face masks and N95 masks are conserved for our healthcare providers and anyone working in a healthcare location. There are options for, in the food establishments, there is no mandate to wear masks, but we are strongly recommending wearing of masks by any retailer or food establishment if you can tolerate it. Just to, again, try to protect those people who may have asymptomatic infection from spreading the virus unintentionally. Dental offices, yes, are being opened for some surgeries and other routine procedures. So check the state health order to see what services are allowable by a dentist office. Someone else asking about a specific apartment complex that may have cases, and again, we don't release that information. That information is only made public if the facility, if the nursing home or assisted living facility or senior apartment facility decides to announce that. And someone claiming that we are not doing enough tests in the nursing homes, and I think that we are doing more testing in nursing homes than I thought we ever would, and we're getting pushback sometimes from, because we've taken this approach, but we feel it's the right thing to do in a nursing home or a long-term care facility that has a COVID positive test. We are doing everything we can to get the nursing homes first to build the capacity for testing so that they can quickly identify COVID if it hits their facility, and then to test liberally patients and staff so that they can identify asymptomatic carriers of virus to try to mitigate the outbreak from the spread in their community. I think we've actually sort of made it more difficult on the state public health lab because we are relying on them heavily to assist some of our smaller facilities who really did not have the capacity for pulling specimens on site, and we're trying to get them to do that. So I just want to read maybe 2 more questions here. I think I have time. Yeah, okay. Is it okay for me to donate blood? This is really important because now that essential surgeries, or non-essential surgeries rather, and non-essential health procedures are starting again, we have been seeing a lot about the blood banks needing blood donors. So CDC has said that in healthcare settings across the U.S., donated blood is a life-saving essential part of caring for patients. The need for donated blood is constant, and blood centers are open and in urgent need of donations. Encourage people who are well to continue to donate blood if they're able, even if they're practicing social distancing because of COVID-19. CDC is supporting blood centers by providing recommendations that will keep donors and staff safe. Examples of these include spacing donor chairs 6 feet apart, thoroughly adhering to environmental cleaning practices, and encouraging donors to make donation appointments ahead of time. So please, if you have been a a blood donor in the past, please continue that. And if you feel like you are well and can help our community by being a new blood donor, please contact your local blood bank and talk with them about if you are eligible to donate blood and making an appointment to do that safely. All right. I want to once more read the information about the expanded symptoms information that we have received from CDC. It's changed slightly, and I just want to make sure I let you know, because again, we're asking folks who are in that 65 and older category or who have underlying medical conditions to pay very close attention to your health. And I want you to add these things to your daily list of observed symptoms. So right now, if we consider you having a symptom, you may have a symptom of COVID if you have cough, or if you have shortness of breath or difficulty breathing, or you have at least 2 of these: fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell. Several of these are new to the list, so I want to make sure everyone jots these down, and these are the ones that you need to self-observe for every day: cough, or shortness of breath, or difficulty breathing, or at least 2 of these: fever 100.4 or above, chills, repeated shaking with chills, muscle pain, headache, sore throat, new loss of taste or smell. Is that a question?
1 minute.
1 minute. Okay. So with that, I'll end today. Remember, on Wednesday, the Unified Command, the health officer, Dr. Eichhold, the mayor, and the county commissioner will hold a joint press conference at Government Plaza, and that will be in lieu of our 2:30 update tomorrow. So we'll see you again on Thursday. Be well and stay safe.
This has been a Fox 10 News coronavirus update. For the latest breaking news, stay with Fox 10 News on air, online, and on the Fox 10 News app. We now join our regularly scheduled program already in progress. From Fox 10 News, this is a coronavirus update.
Lee Stimson coming to you from my office. It is Tuesday, May 5th. Happy Cinco de Mayo. You know, about 10 minutes after 12 today, I happened to be looking out my window, and I saw 2 F-16s flying by. They were part of the 187th Fighter Squadron, out of Montgomery doing a flyover for our hospitals in appreciation for all of our healthcare workers. Don't know if you got to see them, but there's a lot of appreciation by a lot of people thanking our healthcare workers for all that they're doing. Today is also Teacher Appreciation Day. Typically when you have Teacher Appreciation Day, you think of that teacher that's in the classroom, knowing that she's churning away, trying to teach your children, your grandchildren, nieces and nephews and so forth. But today, those teachers are still working hard. They're not in the classroom, but they have some, I guess, what would you call it, a teacher helper? And that's that teaching mom at home. And so the mamas that are home or the daddies that are home doing the teaching in the absence of the children being in the classroom, I think that there needs to be a lot of appreciation expressed to them also. Today I would like to thank the City Council for approving the resolution to fund the testing of our senior citizens, and those are typically senior citizens in our housing projects and our homeless population. They had an opportunity to do that, and so I'm not sure exactly when that testing is going to start, but I know that Franklin Clinic will be starting it pretty soon in the Crichton Towers. So that's a very important part of our fight against the COVID virus, because you have a bunch of elderly people that are living in close quarters, and so we're not too early in making those tests, getting them out there on the ground. So thank the City Council for doing that. I also would like to thank the City Council for approving the transfer of $500,000 in an effort we call Ignite Mobile. And Ignite Mobile, as you may know by now, is to fund those businesses, or the close contact businesses that fell through the cracks with the funding of PPP, and those employers whose employees could not get workman's compensation. Later today, if not later today, first thing tomorrow morning, we'll be reaching out to all those who we think qualify for these grant opportunities, and we'll start actually taking the grant applications so that next Tuesday when the City Council meets, that we can actually start distributing the money shortly after that meeting. And some of that money will be distributed through direct deposits, and some will be distributed just through manual checks that people can come by, to pick up as part of this grant program. Another thing is that this morning you may have seen that at 8 o'clock, Sheriff Cochran and I were outside the jail. We were testing all the employees at the city jail. There are about 50 people, I believe, that he has contractors that provide health services for the jail, plus 180 so correction officers. So over the period of today and tomorrow, we will have tested all of those who volunteered to be tested. Excellent turnout this morning. And what we're doing is we're trying to identify those who are COVID positive, maybe asymptomatic, but shedding the virus, and we want to isolate them and get them out of the jail so that they won't continue to spread that. Really huge thanks to USA Health for doing that. They worked in conjunction with Mobile Fire Rescue and stood up in a matter of 24 hours, just a couple of small tents, and actually built some, I will call it a cubicle, but it's a plexiglass and plywood shield that the nurse, the healthcare provider could stick their hands through the plexiglass holes, reach out and administer the nasal swab test to the employees. And that was done because we couldn't do drive-through testing where someone's sitting in their car and you do it through the car window. But in an effort to protect the healthcare workers, the Mobile Fire Rescue Department created these cubicles, worked with USA Health and Synergy Lab, and so we should be getting a lot of results back in the next 24 hours of those who were tested today. So still a lot of activity having to do with testing, activity by the City Council that's encouraging, reaching out into the community to help those that need help, and also to support the testing that's been going on. So I'll flip now to George and see if you got any questions from the media.
I have one from Fox 10 that is asking for your reaction to an article quoting the state health officer, Dr. Scott Harris, in which he talks about the number of cases in Mobile and says that they were a little bit later in Mobile than some parts of the state in getting testing up and going. And they would like a reaction to those comments.
Well, when he says they in Mobile, I assume he's talking about just the city of Mobile, but upon finding out about what was going on in the testing world, realizing that the city of Mobile didn't have tests, that's when we sent employees from the city, from the public safety department, actually to go up there and find out what they were doing at the Church of the Highlands. And it was shortly after that we got the rapid serum test. We tested all of our first responders, and I will say it again, I think we were the first city in the nation to do the screening test using rapid serum on all of our first responders. And since then, we've been playing catch up with the PCR testing, but with Synergy Labs doing what they're doing, they'll continue to increase their capacity. So yes, maybe the city of Mobile was, but I think that that's a shared responsibility of the health department. But I won't necessarily get into that. But from the city's perspective, we engaged and we made a lot of things happen. But yes, we are playing catch up, but we will catch you.
That's the only question we received.
Okay, well, appreciate you being with us this afternoon, and just remember it's your responsibility to take care of your health, and that's by doing the things that you know that you need to do: social distancing, wearing your face mask, washing your hands, and so forth. So thanks for what you're doing.
This has been a Fox 10 News Coronavirus Update. For the latest breaking news, stay with Fox 10 News on air, online, and on the Fox 10 News app. We now join our